Hello, this is Dr. Feast Price, and I'd like for us to continue our lecture on individual and family functioning, paying particular attention to when family therapy is needed. I'd like to proceed by talking about 3 time dimensions that are specific to an individual, and it reflects some of the life changes that persons as well as family members make experience that contribute to family dynamics. The first is individual time. There's also social time and historical time. Individual time conveys one's span of life between birth and death, and it encompasses some of the notable individual accomplishments. So within this sphere of understanding some of the issues that persons might present with, it's important to recognize whether they're individual in nature, whether it has something to do with where they are in their developmental trajectory. With regard to the social time, it's specific to landmark social events such as marriage, divorce, parenthood, and retirement. And depending on where an individual is as it relates to the social time, it will indicate what some of those stressors are. So we know that if a client comes in, they're presenting problems associated with marriage or family kinds of issues, it's important to look at whether there are some landmark issues, specifically landmark social issues that might be coming into bear and might contribute to some of the family problems. Also, as mentioned previously, one would also want to look at some of the individual issues or problems that they might be exhibiting. From a historical time perspective, it has to do with the era people live in, also the culture of the time. And so it forces, these might be forces that affect or shape a particular point in time. So if you consider the economic standpoint, the economic issues that exist in society, it may be issues related to the war that we're faced with, but it's any kinds of major issues that are specific to the time period. And so these issues might also impact not only on the individual, but the family members as well. So basically what you have here are 3 key dimensions of time that may negatively impact the individual or the family in such a way that such issues must be addressed in order to bring about homeostasis within the family functioning. There are also family life stressors that may be horizontal or vertical in nature. As it relates to horizontal stressors, these are aspects of life that relate to the present. They may be developmental and unfolding issues. It might be education as well as employment kinds of issues. Also, there may be vertical stressors, and these are the stressors that bring past and present issues to bear reciprocally. So it could be a family's attitude or expectations or secrets and legacies. They may be historical and handed down from one generation to the next. So again, these are various kinds of stressors. They fall into one of 2 categories, and it helps us to understand what some of the issues are that a client or the family or individuals within the family may be presenting when they come in for therapeutic treatment. So there are different kinds of communication structures that exist within the family. There's also various kinds of functioning within the family. So when you consider the symmetrical versus the complementary kinds of communication that exist within family, symmetrical communication is the communication that exists between 2 equals. So 2 persons within the family that holds equal power and position within the family. There's also a complementary kind of communication that exist within the family where it's more of the top dog, underdog, or superior, inferior. So it suggests that one person within the family system holds a higher position or status than the other persons within the family structure. There are also centripetal and centrifugal families. Centripetal families are moving toward family closeness. It display more family cohesion, the appropriate level of diffusion within the family. Centrifugal families are those families that are moving away from family unity. It conveys that the family members are more dispersed, and there's less cohesion that exists within the family. Most importantly, you want to assess the extent to which there is cohesion or emotional bonding within the family, as well as adaptability, which is the extent to which family members are able to be flexible and adaptable in the change processes that might exist within the family structure. So again, these are three categories that display family functioning, and it conveys some of the problems that one might see within a family. So it helps you to diagnose some of the family problems and being able to identify whether the problems are symmetrical or complementary, centripetal or centrifugal, cohesive versus non-cohesive, and adaptability. And so it also gives you some insight as to how best to intervene with or assist the family in its functioning. Also within a family are both circular and linear causes of family trauma or crises. For circular kinds of problems, there's a causal chain that influence, and it begins to impact the way in which other persons within the family interact with each other. So some people might see it as a causal chain or a domino effect, but A precipitates B, which causes C, and so on and so forth. So if you use the example that's presented here, it might be a father who comes home angry as a result of something that might have transpired at work. They may drink as a means of coping, which causes the husband and wife to fight. And then this fight, or the stressors associated with the fight, leads to more anger, drinking, and fighting with the wife. And so it's more of a circular kind of situation where problems go round in circle without a cause, a clear way of breaking the cycle. There's also a linear causality, and in such instance, it's moving in one direction with each action causing another. So if you take the example that's presented here, it might be an economic depression. You know, right now we're in an economic depression. As such, there's a loss of jobs. When there's a loss of jobs, there are fewer financial resources. As such, people may lose their homes or those things that provide stability. And along with those problems, there might be family problems, and it leads to a divorce. And so there's more of a linear causality where one precipitating variable impacts a chain of events that bring about problems or devastation within the family. Cybernetics is a way in which we explore the communication loops that exist within the family. There's a negative feedback loop through which a system receives information. And so when you have a negative feedback loop, it produces deviation, and it helps the system to maintain the status quo. And the operative part here is the maintaining of status quo. And so in the negative feedback loop, most often than not, persons are trying to maintain a status quo or maintain some kind of functioning rather than focusing on the problems at hand and causing the feedback loop to change in some way. There is also a positive feedback loop, And with a positive feedback loop, it amplifies deviation or changes and thereby disrupts the system. So when people come in for family therapy, one of the primary areas of intervention is on the feedback loop. So rather than allowing the communication styles within the family to be maintained, there is the positive feedback loop whereby you want to amplify deviations and thereby change or disrupt the communication system. So there are various rationales for working with families, and below are three core rationales that exist for working with families, particularly as a family therapist. So first and foremost, there is the belief that most life difficulties arise and can be best addressed within the family context. So if there are problems within the family and you're able to resolve the problems or differences that exist within the family, persons are better functioning. There's the belief that family therapy is effective, and there is also a greater satisfaction among participants. And we know that where persons are more satisfied and there's a better outlook on things, it often impacts the way in which we interact with the world. So there are both individual and family therapy, and we recognize that there are times when persons come in for therapy for individual therapy, but there are also times when persons come in along with other members because they recognize that the problems are more interpersonal in nature rather than intrapersonal. So if it's problems within the individual, it's usually intrapersonal within the individual. And if it's problems that exist with others, it's interpersonal. So it's the recognition that individual problems are related to family problems. Also, it involves other real significant people in the client's life. And so in order to best resolve some of the problems that an individual will present with, you will have to intervene with the family rather than specific to the individual. And all members of the family are given the same message rather than the attention and the treatment focused on one individual. All family members are presented with the same message, which impacts the likelihood that there will be a transmission of positive behavior change across the family rather than in only one pocket of the family. It takes less time than individual therapy because if each person within a family unit is involved in individual therapy, it can be very costly as well as take a great deal of time. However, when persons come in for therapy as a family unit or cluster, you're better able to intervene with the entire family rather than with individuals, and also over a shorter period of time. So there is a focus on interpersonal issues. So problems or issues that exist within various persons in the family rather than looking only at the individual and trying to resolve problems or conflicts within the individual. So who are family therapists? When you think of persons that are functioning as family therapists and what some of their attributes are, who are they exactly? And so research shows that family therapists are most likely to be eclectic, which means that they borrow from various therapeutic orientations. They're not necessarily wedded to one therapeutic orientation. And one of the things you will see as we talk about different theories of family therapy, you'll find that there's a lot of overlap. And so most often, persons who identify as their family therapists are also most likely to be eclectic. And so they borrow from various therapeutic orientations to meet the individual needs of a particular family. Also, family therapists espouse the personhood of treatment. They believe that the most powerful and profound aspect of the treatment process is the therapist and the therapist's ability to interact and develop a relationship with family members. So it also goes back to what we've learned in individual therapy. The most important essential ingredient that a therapist can have is effective communication skills, interpersonal skills, and connect with the people with whom they serve. So again, the power of the person, the power of the therapist to form relationships, to be genuine, congruent, person-centered, those are very important attributes of a family therapist. You must also respect the values of others. Every family comes with their unique set of values. You will not find two family members that are alike. And so, as such, you have to respect the values of the family members. While you may not agree with the values, it's important that there is a level of respect, because without the respect that goes along with working with families and working with individuals that entrust you with, some of their issues and concerns that are very personal and private, you too must respect and be respectful of the values of others. You must be dedicated to working with families and assisting them with meeting their needs. If there is no dedication for the work that you do, for the ability to meet with families, to hear the issues and concerns that they bring to the therapeutic sessions, then you're not in the right profession and you shouldn't work as a family therapist. There should also be an awareness of families' issues that they present with, some of the different kinds of time constraint issues, individual developmental factors, as well as family developmental factors that exist that might negatively impact on individuals as well as the family. So a knowledge base and awareness of critical issues regarding the family is very important. As a therapist, you too must be mentally healthy and stable. So if at any point in your life you're going through issues that impede your ability to be healthy, present, aware of what is going on in a therapeutic interaction, not only do you owe it to yourself, but you owe it to your clients to take a break and to become mentally, physically, and emotionally healthy so that you can assist the clients whom you serve. So if there are times when we personally, as therapists, might have life experiences that exist. We're not immune from problems. Sometimes it might be issues related to marital discord. It might be problems with their children or our family members. But if ever there are issues that are negatively impacting your well-being, you have to get those issues attended to so that you can be the best therapist possible for your clients. As one who works as a mental health provider, I know that I cannot be the therapist I need to be if I am not rested, if I am not mentally, physically, and emotionally healthy, because then you're susceptible to all kinds of problems occurring, whether it be negligence or different other kinds of ethical issues that might occur. So make sure that you're mentally healthy when you are working as a clinician. You also must be intuitive and feeling oriented. Compassion is very important. We talk a lot about Rogers' 3 necessary ingredients to be a therapist, and he talks about empathy or unconditional positive regard for the individuals that we work with. Congruence is another important ingredient. So we have to be able to be person-centered, person-focused, family-focused as well when you espouse to be a family therapist or a therapist in general. So all of what I'm talking about here as it relates to family therapy really transcend just being a family therapist, and it really pertains to being a clinician in general. So not just a family therapist, but an individual therapist, group therapist. All of these ingredients are essential to working as a clinician. So some of the problems that exist with some of our beginning family therapists is an overemphasis on details. We want to understand all the particulars of a story. So we want to hear the story from beginning to end. And we recognize that there are times when our clients come in, they want to tell the story. And it is important to give clients an opportunity to tell the story. It's therapeutic for them to be able to do so. But in addition to allowing our clients to tell the story, we as therapists, we don't have to understand all the particulars associated with the problem. Sometimes you have to understand what are the salient issues: communication, respect, mutual positive regard. So you want to grasp what the core issues are rather than being bogged down with the details, because that can be time consuming. You recognize that in a therapy session, 50 to 90 minutes is the length of most therapy sessions. So if you allow the client to give too many details, you would spend your time on details and you spend less time on overcoming issues. You have to also realize you can't make everyone happy. In a therapeutic session, particularly when there are multiple family members involved, everyone in the therapy session will not be happy. So you can't make everybody happy in the therapy session. You can't appease everyone, but you have to be aware of what your primary goals and functions are within the therapeutic interaction. So be mindful of the need to make everyone happy, or to keep people from being angry or frustrated or upset, because sometimes, especially when you're going from that negative feedback loop or communication loop to a more positive communication loop, you have to disrupt the status quo. And when you're disrupting the status quo, inevitably some people will not be happy. And so recognize that it is okay that everyone is not happy, but through growth, it can be a painful process at times, but to get to the other side is ultimately what your goals are. Verbal expression. There are times when counselors, especially new counselors, they're not willing to give their own opinion. They focus a lot on the details. They're not as focused, they're more focused on verbal expressions, like what people are communicating, and they're less focused on some of the nonverbals, like paying attention to the way a person's body is communicating certain things, or whether they're a closed communicator or open, how they're sitting. Whenever I work with couples or family members, I always notice who's sitting next to whom. If it's a couple, I always notice whether they're sitting where they're touching or whether they're apart. Sometimes people, if there are pillows on the couch, they will intentionally take the pillow and put it in between them. All that is relevant information that you have to pay attention to. So be mindful not only of the verbal communication, but nonverbal communication. And again, with beginning therapists, there's more focus on what persons are saying verbally, and less communication on and less focus on some of the nonverbals that give a lot of very relevant information. There's also the belief that for some beginning therapists, particularly family therapists, they come to an early resolution, or they come to a resolution too easily. So without understanding all of the dynamics and all of the ways in which the problems exist, they're quickly arriving at resolutions or solutions to the problem rather than allowing it to evolve in a more systematic way. Because that's when you allow the resolutions to occur more gradually, people are more likely to incorporate, to be reflective and incorporate uh, the information that they're learning over a longer period of time. They're more likely to be cognizant of what you're saying to them rather than just focusing on, the quick fix, the quick behavior change. Also, among beginning therapists, there's the focusing on one family members versus all of the family members. So when you're working with multiple individuals simultaneously, it's almost similar to group therapy. You cannot focus on just one individual. You have to focus on multiple individuals simultaneously, because to focus on one individual means that other members in the family are going unheard and problems are not resolved. But we also recognize that with beginning family therapists, there is an underemphasis on establishing structure. So we have to structure the therapy session by finding out what are the presenting problems, what are the primary goals of the therapy session, and then helping them to move through the therapy session in a structured fashion. So you always want to know what are the goals, and then how do you help the person achieve their goals in the therapeutic context. You want to, there's an underemphasis on showing care and concern. So sometimes beginning therapists might appear kind of robotic, they're less comfortable, there's less conveying of care and concern. They're engaging family members in the therapeutic process. So there's an underemphasis in engaging all family members in the therapeutic process. And also there's an underemphasis in letting the family work on its problems. It's always important to give homework so that when they leave the therapeutic process, they are able to work on issues, their problems at home. So homework is essential. Getting them to try out different kinds of behaviors that are less familiar. So doing active listening rather than interrupting, making I statements. I feel unhappy when I ask you to do something and you don't do it. Or being more concrete in terms of communicating. When you ask your spouse to do something, talk about timelines so that you don't have to constantly remind him about getting something done. Also, making everyone happy. Sometimes there's an underemphasis on making everyone happy, or there's an overemphasis on making everyone happy. And we talked about attending to nonverbal dynamics. Sometimes there's an underemphasis on focusing on nonverbals and more of an emphasis on focusing on what's communicated verbally. The therapeutic sessions should be based on the therapist's impressions of the family, their theoretical position, as well as the clinical skills. So when you work with families, you're formulating hypotheses associated with the problems. What are some of the problems? You're as they're telling their story, you're gathering information and you are developing a hypothesis of what some of the problems are. There are both theoretical tenets that you borrow from, so you have to be mindful of different theoretical frameworks that you will borrow from. If you're eclectic, it's okay to be eclectic, but you want to also make sure that you have different tools with proven effectiveness in working with the family. And you have to have really good clinical skills. You have to have good interpersonal skills, good communication skills, listening skills. You have to use a lot of your active listening skills, the open-ended questions, paraphrasing. all of the critical information you've learned in your Theories of Techniques 1 and 2 classes are essential in working with families. So in a nutshell, that kind of ends our discussion as it relates to some of the individual and family issues that must be taken into consideration when working with family therapy, as well as some of the things that we as family therapists must bring to the therapeutic process. Understanding that sometimes as a beginning therapy, you're more inclined to do certain things, less inclined to do others. But if you're mindful of these things on the front end, you can sometimes even write a little note to yourself to pay attention to nonverbals, pay attention to the body language, pay particular attention to who's always first to answer the question, and encouraging the other partner to answer first rather than always one person answering first. So this is just an overview of some of the critical issues of the family, the rationale for working with the family. I hope you find this information helpful, and I will continue our next lecture with additional information relevant to family therapy.